Mondays, I'm here at bingo, working on the bingo team. I've just helped finish setting up, making sure everything is in the spot it's supposed to be. And then at 6 o'clock, I make out checks to the winners. So everybody loves me because I make out the checks. It's fun. And I meet a lot of people. I mean, some of these people I never met are friends now. They're not people anymore, they're friends.
We know that patients with heart failure end up being hospitalized over the course of time, and each hospitalization matters. The statistics say that if you're hospitalized with heart failure, we should take note of that, because over the next 6 months to a year, your risk of not doing well is higher than it was before you were hospitalized. So a heart failure hospitalization is a kind of key inflection point, if you will, in the life of a heart failure patient.
I kept filling up with fluids, which is called congested heart failure. When you have congested heart failure, you can't breathe. I kept ending up in the hospital for a week at a time. Probably 5 times I've been in the hospital.
The CardioMEMS system is an implantable pulmonary artery pressure sensor. And when we implant the device in the patient's pulmonary artery, right through a blood vessel in the groin, we know what the reading on the device is at that time, we know what their pressure is, and we match those two. So then in the future, we can know what someone's pulmonary artery pressure is. And that pressure matters because it tells us if the pressure's going up, that patient might be heading towards a heart failure event, and maybe we can stop that before it happens by increasing their therapies, as opposed to them just slowly slipping into heart failure, getting past that early detection point, and ending up in the emergency department and in the hospital.
The CardioMEMS program, I look at it as additional data. For our patients, often they get fluid overloaded, and we know that the patient's starting to put fluid on before they know they're getting fluid on.
I have it reading every morning. I get onto the pillow. I have a control, and I press the control, and it tells me to lay still, and it measures me, takes about a minute, and it puts the reading into the hospital. If I have a problem, they call me. Sometimes she calls me anyway.
I will see on the computer program, I'll look at her readings and I'll see that she's ranging up, and I'll call her, and she may not feel like there's any change, but I'll say your numbers are up.
Even if it's up a little bit, she may call me and tell me, you know, you're going up a little bit, maybe we need to know what's going, and she'll talk me through it.
I start asking the questions of, you know, is your weight up? Are you breathing differently? And if things are yeses to any of those questions, then we want to adjust their medications. If we adjust their medications in a timely manner, we can prevent them from going in the hospital.
It's kept me out of the hospital about 5 times. And before, I'm always concerned because I was always ending up in the hospital.
In my mind, it's made a big difference. I've made multiple adjustments in patients' care because of the data that comes back.
I think that it's making a big difference in her life and others that are following suit. They much rather be home and living their life than staying in the hospital.
I'm not in the hospital anymore. And there's times if I hadn't had this, I would have been. And this stops it from getting that far.